Hello, everyone. Welcome to another exciting edition of NeuroConnect, our weekly live event dedicated to unraveling the wonders of neuroscience. Together with eminent experts in the field, we aim to support and empower both patients and caregivers as they navigate the challenges of living with neurological disorders. Today, we have gathered here to tackle a topic that touches the lives of so many: anxiety. In a world that often seems to move faster than we can keep up, it's no wonder that feelings of anxiety can arise. But today, we are here to uncover the power within us to overcome these challenges. Anxiety, a familiar yet complex emotion, has the ability to impact our lives in profound ways. It's a natural response to stress and challenges, serving as an internal alarm system that heightens our awareness. However, when this response becomes overwhelming and persistent, it can transform into a formidable force that affects our mental and physical well being. Anxiety often brings along a cascade of uneasy thoughts, racing hearts, and a feeling of impending doom. It's important to recognize that anxiety exists on a spectrum, from the everyday worries that accompany us to major life events to the more intense experiences that can lead to anxiety disorders. The impact of anxiety is not limited to our inner world, it extends to our interactions, work, and overall quality of life. If left unaddressed, it can undermine our confidence, disturb relations, and impede personal growth. It's crucial to recognize that anxiety is not a sign of weakness, rather, it's a reflection of our humanity. By acknowledging anxiety's presence and taking proactive steps to manage it, we can shift from being controlled by it to being in control. So, this process is a journey of empowerment where learning to navigate the challenges of anxiety equips us with the tools to flourish in a world that often tests our emotional resilience. In today's event, we will start by exploring a recent breakthrough, a new blood test that analyzes biomarkers to assess the potential risk of anxiety in individuals. Next, we will be joined by our esteemed guest, Dr. Harbandana Sohani, who will share insights on the journey from fear to freedom, empowering minds to overcome anxiety. So let's begin today's session by learning about an exciting new blood test that helps us understand anxiety better. So, as per the researchers from Indiana University of Medicines, they have developed a blood test for anxiety. As per the research results recently published in the Journal of Molecular Psychiatry, this test examines the biomarkers that can actually help them to determine someone's risk for developing anxiety or severity of their current anxiety, and which therapies can treat this anxiety. The blood test is currently being developed by on a wider for a wider use by physicians by an startup that is Mindex Sciences. The existing method actually involves conversing with individuals about their emotions to determine if medication can be suitable for them. However, certain medications can also lead to dependency and can exacerbate the issues. Hence, researchers intend to explore whether method of identifying blood biomarkers can assist in aligning these individuals with more effective and non-addictive options uh, available for medications. So, as per Dr. Alexander, uh, prior investigations have actually contributed to the creation of blood tests for conditions like depression, bipolar disorder, post traumatic disorder, or pain. So, the latest study actually is using these similar methods for anxiety. So they utilize RNA biomarkers RNA biomarkers in the blood to identify the current state of anxiety, match individuals with suitable medications and nutraceuticals, and to predict future anxiety risk and evaluate the potential impacts. So, this test can also be used in combination with the other blood test as per the doctor, providing a more comprehensive view of patient's mental health and risk of future mental health concerns. So, as per the researchers, this can also be used to test to develop new treatments for anxiety that are more targeted to individual biomarkers. To drive this further and to strengthen our understanding, today we are privileged to have Dr. Harbandana Sahani, an experienced psychiatrist with a demonstrated history of working in the hospital and healthcare industry. Her expertise spans psychiatry, community mental health, addiction medicine, and child mental health. Throughout her remarkable career, she has been associated with prestigious institutions such as Max Healthcare and Dr. Babasaheb Ambedkar Hospital, and she is currently associated with Sohani Medical Center. Welcome, Dr. Sahani.
No.
Hello, welcome.
Hello. Yeah, yeah. You can hear me?
Yeah,
Okay.
thank you for joining our event today.
Hello.
Yeah. So before we begin the discussion with Doctor, we encourage our audience to ask questions and share their experiences so that we can have an interactive discussion. And we will be addressing these questions at the end of the session. So without any further delay, let's now start today's discussion. So, doctor, to begin, let's address one of the most common questions we often have. So that's is stress and anxiety. Is it a is anxiety a normal part of life, and is anxiety always a bad thing?
Okay. So, yeah. Hi. So, first of all, good afternoon. I'll start with your first question regarding stress and anxiety. Okay, so what is stress? Like we often, like you mentioned, confuse between the two terms. So, stress is actually any external situation or circumstance which we might have difficulty in coping with or which might challenge our coping mechanisms. Okay. For example, if we have an exam coming up, or if we have to attend a date, or if we have to attend an event with new people around, so that is a challenge for us. So that creates a stressful situation. Anxiety is our response to that situation. Okay. So, to your question, stress first, is stress always bad? It's not always bad, because some sort of, we need some sort of challenge or thing in our life to kind of grow ourselves. Okay. So, it's like a spice, a little bit of it is important to, make our day or journey worth it. But when it becomes a little more, or when the situation becomes a little more overwhelming, that is when it is difficult to digest. Okay. So stress, like I mentioned, is the situation or circumstances which challenge our ability to cope. And what is anxiety? And is it always a bad thing? So no, anxiety is a part of our normal life, and it's not always bad. I'll give you an example. For example, you're walking in a forest and you see a lion in front of you. Okay. So our brain is wired to fight that lion or run away from it, or we might just freeze. Okay. Our response would be like, we are very daring. We might try to fight it, which is not uh, always possible. But our anxiety response would be either to, run away, or kind of freeze and hide somewhere so that that lion cannot see us. Okay. So our brain is wired to face difficult situation or challenges and get scared when we need to be scared. This situation warranted us to be scared so that we could take the right step, for that this thing. Or for example, I had this talk coming up. Okay, if I would have been laid back and not worried about it at all, so I would have not made any initiative in maybe up upscaling my knowledge or adding a few things or things like that. So some sort of normal anxiety is required in response to the situation for us to excel or do better, or whatever the situation warrants. Okay. So
Yeah.
when does it becomes a pathological anxiety or an anxiety disorder? So in that we have to go through things, whether the situation requires us to be scared or not. When our estimation or how we perceive the situation is more dangerous or more harmful than it actually is. Okay. And when we underestimate our ability to cope, like I gave the example of this talk. So if because of this challenge which I got, if I would have been overwhelmed that, oh, will I be able to deliver, or oh, will people, how would people judge me, or would I be interesting enough? Would it be relevant to people around me? And those thoughts started paralyzing me, or would not let me focus, or I would have avoided taking up this talk altogether. Okay.
Yeah.
So that way I had hindered my ability to grow or take this challenge. Or it would have I would have if I would have not taken this talk, I would have been comfortable because I did not have to take the talk. Okay. But
Yeah.
I would not have learned to do public speaking in a better manner, or maybe read a bit more. Okay. So that has interfered with my functioning. Okay. So that is when it becomes a pathological anxiety or part of anxiety disorder. When we overestimate the problem and underestimate our ability to cope, and that starts, affecting the way we feel about it. We feel panicky, or way we think about it. Like we start worrying excessively, or it affects our behavior in the sense that we avoid taking up challenges or facing that situation.
Yeah. So, so you mean stress is a response to external pressures, while anxiety is a more generalized feeling of uneasiness.
So stress is basically the situation or circumstances, and anxiety is our response to that. Okay.
Yeah.
And when it becomes more, that becomes an anxiety disorder.
Yes. And some level of anxiety is normal in a life, as it can motivate and alert us for.
Alert us. Yeah,
Yeah.
you use the right word. It is the
Yeah.
alerting mechanism. It is the alarm which our body has prepared.
Yes.
Okay. But in anxiety disorder, this alarm is in hyperactive mode.
Mhm. Okay. So, can you explain what an anxiety disorder is, or and what are the different types of disorders, anxiety disorders? I mean,
Yeah. So when I mentioned about like in the past question, anxiety disorder, or when does an anxiety becomes pathological? Okay. So that is when we need to intervene or see, if it's an issue, if it is interfering with our routine activities. Okay. So it can present in various ways. The most common of it is generalized anxiety disorder. Yeah, generalized anxiety disorder, like I mentioned, that brain is always on the alert mode. Okay, that alarm is always on. So from in our thought level, we might always be preoccupied, tense, always, kind of feel on the edge, or we might worry excessively. For example, if we have a party coming up, so normally we would be excited that this is what I have to wear. These are the people I'd be meeting. This is what we'll talk about or discuss, or I learn new things from them. Okay, person with generalized anxiety disorder might worry that people might judge me, or what will they think of me, or will I look good enough, and things like that. Okay, and this is, like I mentioned, on the thought level. And whenever we are scared, our body starts reacting to fight that stress. Okay, so some physical signs of anxiety might crop up, like palpitations, restlessness, these kind of feel. So when that occurs throughout the day for most part of our life, and we are always preoccupied and tense in most of the situation, we might have heaviness in head, you feel like urinating frequent times, or there might be a feeling in our tummy, restless feeling. These are the symptoms of generalized anxiety disorder. Okay. When this
Yeah.
anxiety presents in some specific situation or circumstances, then it becomes a phobia. Okay.
Okay.
So if I have that anxiety only when I'm meeting certain people or going in groups or doing public speaking, but otherwise I'm overall relaxed, then I am having social phobia. Okay. Or fear of closed spaces, then I have claustrophobia. So phobia is anxiety in some particular situation, and when we tend to avoid that situation. Okay. And the third is panic disorder. So in panic disorder, what happens is that our mind anticipates a threat in a very acute manner. At any time, we might feel very overwhelmed and tense, and have a feeling of impending doom, that something bad is going to happen right now, and our body starts reacting to fight that stress. So, like I mentioned before, if there's a lion in front of you, your body will do something to fight that lion. No. What will it do? It has to run away. So heart will pump a little faster. So heart will pump a little faster, heartbeat will raise. When the heartbeat raises, the oxygen to brain goes a little low, so we feel little dizzy. Our hands start trembling. We might feel our muscles becoming tense. So in panic disorder, what happens is that there's no lion in front of you, but suddenly that alarm goes off and we feel that something very bad is going to happen, and our body starts reacting to fight that or run away from it. And we are already tense and our body is reacting, so we become more worried, which we call meta anxiety. Okay. So when this occurs as an acute episode of 15 minutes to a half an hour or so, in which is accompanied by these physical signs, palpitations, restlessness, sweating, trembling, and main is feeling of impending doom, that I'm going to die, something very bad is going to happen, then that is a panic attack. So most of the patients with panic attack present in emergencies. They get a ECG done and basic test for general well-being done, which is also important to rule out the medical cause.
Okay.
And if this persists, if they have these episodes abruptly, there is no physical cause for that, then this is a panic attack. And if it occurs frequently, then it becomes a panic disorder.
Okay.
Another type of disorder which sometimes fall in the spectrum of anxiety disorder, obsessive compulsive disorder, okay, in which patient might have obsessive thoughts regarding certain things like cleanliness or checking, obsessive doubts, and he might redo those things again and again to confirm that he or she has done it properly. So that is a compulsive act.
Yeah.
Another type of anxiety disorder is post-traumatic stress disorder, which happens after very catastrophic or overwhelming stress or trauma, an accident or history of abuse. So, patient with post-traumatic stress disorder might have nightmares or hyperarousal. He might avoid those situations. So that is which occurs after a major stress. Yeah, so these are some of the common types of anxiety disorders.
Okay. So that means anxiety disorder actually involves excessive and persistent worry or fear that actually interferes with our daily lives.
Right.
And these disorders can vary in severity and can have an impact on a person's life accordingly.
Yeah.
So now, can you help us understand the common symptoms of anxiety disorder?
Yeah, symptoms like I mentioned in the previous question as well. A patient with generalized anxiety disorder might be preoccupied, tense, worried. Might have the physical signs, palpitations, restlessness. A patient with panic disorders might have those as an acute episode, and a patient with phobic disorders would have those in the specific situation. So a lot of times patient might come to us with some unexplained pains or ache. They might present differently. So a patient with generalized anxiety disorder might not always come to you with excessive worry. They might come with certain physical symptoms like heaviness in head, some palpitations, or feeling of uneasiness always there, some uncomfortable feeling in the stomach. And then on talking and on probing more, it might turn out to be a case of generalized anxiety disorder when it is accompanied by preoccupation or worries most of the day, not feeling relaxed, feeling on the edge. These are some of the common symptoms
Okay.
of anxiety.
So as you talk about the panic attacks and we understood the different symptoms of anxiety disorders, can we understand what is the difference between panic attack and anxiety attack?
So, anxiety attack per se, panic attack, like I mentioned, is an acute episode of anxiety which occurs for 15-20 minutes and which has feeling of impending doom. Okay? Anxiety attack is not panic attack. We could call it as a type of anxiety,
Okay.
attack. Anxiety is a more generalized term, if we would call that. Okay? So if it is something which is not fulfilling the criteria of a panic attack, it's just generalized anxiety and stuff like that. So that would come as uh,
So
anxiety.
you mean panic attacks and anxiety attacks they share similarities but
So, the term for an
differ.
attack is the panic attack. That is what it is, an acute episode. Anxiety is a more generalized term. Okay?
Okay.
Anxiety attack per se is not a particular disorder or term which we use very frequently. Okay? A type
Hmm.
panic episode is a type of anxiety attack. Like anxiety attacks you suddenly. That is what a panic attack is.
Okay. So what leads to the development of this anxiety disorders? Are there specific factors that increase the likelihood of experiencing an anxiety disorder?
Yes, so there could be external factors like overwhelming stressors, which are ongoing stressors which are there. So if there is someone who is experiencing some stress at work in terms of always deadlines are there or the situation around them is not very conducive, so they might be prone to anxiety elsewhere also. Or if there has been a history of a trauma or abuse in the past or in childhood, so those patients are more prone to anxiety episodes later in the childhood also, later in their adult lives as well. Okay? Any recent major catastrophe or stress, these are the external factors which might make one prone to external situation related factor. Okay? Then it is the genetic basis which is there for most of the illnesses. So if there is a family history of anxiety disorder, any of the disorders, then they are more prone for anxiety disorders. Family history of any mental health issue sometimes makes one more prone to anxiety episodes. and
Okay.
that is genetic basis for it. Then also depends on our personality and our ability to cope. So if someone by personality is anxious, or they might be more prone to anxiety uh, episodes, shy or introvert in social situations, and then the biological basis for it, or the neurotransmitter. So there are certain chemicals which help us to feel happy and relaxed. So they go low in anxiety. So that can happen on its own or in response to these stressors which are there. So that could make a person more prone to the anxiety episodes.
Okay. So, as we understand that the development of anxiety disorders can be mainly due to a combination of genetic, environmental, and psychological factors.
Yeah.
Uh, but who can treat this anxiety disorders? I mean, who are the specialized doctors who will be involved in the treatment of anxiety disorders?
Yeah. So, like I mentioned, the cause for anxiety disorders is multifactorial. There's psychological basis for it, biological, genetic basis for it. So, the treatment involves a combination of treatment by both psychiatrists and psychologists. Okay. So, the psychiatrists, they are the medical doctors. So, our main role is giving the medicine, treating the biological basis for it, yeah, taking care of the physical symptoms if there are any. And as I mentioned, because there is psychological basis for it, and for anxiety specifically, because it involves working on our coping strategies also, and reframing our thoughts. There are certain skills which help us to cope with anxiety better. So that part is taken care of by the clinical psychologist, the
Okay.
clinic therapy part. So both work together to help a patient to give a holistic treatment.
So, what are some of the medications that are used to treat anxiety disorder? Are these medicines habit forming or addictive?
Yeah, so that is actually one of the most common concerns with most of the patients come to us. Okay, so when a patient comes to us with anxiety disorder, so first we have to, like you mentioned initially about the test for anxiety disorder. So those tests are in development stage.
Yes.
So none of the tests are yet what we have in our labs to test the level of the neurochemicals right now. We need them, but they are not there right now in practice as much. So basically, the diagnosis is based on the history and symptoms and the mental status examination, as in what we observe when we talk to the patient. Uh, First we do, but there are certain biological conditions which makes a person more prone to anxiety, or certain blood markers, which I would call them endocrine factors, like a patient with thyroid, with hypo and hyperthyroidism, they are more prone to anxiety. A patient with B12 and D3 deficiency, they are more prone to anxiety. First, we would want to rule that out and clear that. Okay? Because those are
Okay.
aggravating factors for anxiety. Okay? They have been taken care of. Then the medicines which we commonly use, the most common ones are serotonin reuptake inhibitor. So, like I mentioned, that there are certain chemicals which sometimes go low, and
Yes.
because of them those chemicals going low, we might not be able to filter certain thoughts out. For example, we know that this situation doesn't warrant that much thinking, or we have to put our thoughts into action but not our worries, but our mind is not able to filter those thoughts out. So why that is happening? Because serotonin, one of the chemicals, is going low. So how
Okay.
these medicines act are, they are serotonin reuptake inhibitors. They are breaking down faster in us. That is why we are those levels are going low. So those medicines prevent that fast breakdown,
Okay.
and we give it for a few months to maintain the level of that chemical. So SSRIs, or serotonin reuptake inhibitors, they are not habit forming medications, but we have to give it for some months, like 6 to 9 months, to maintain the level of those chemicals and then taper and stop them.
Okay.
Yeah. So this is what the research says, that then the relapse are much lesser.
Okay.
Along with the medicines, these medicines, there are certain medicines which helps one sleep and which helps in acute, control of anxiety, which are the benzodiazepine or hypnotics or tranquilizers are the other name for that. Okay? Those are something which we prefer giving short term, because the first medicine might take some time to start acting. So during that time, for short-term anxiety relief or for an SOS basis, you can take these medicines, and we do prescribe them for immediate relief of symptoms. But those, if taken for very long, can be a bit habit forming. So we generally don't prefer giving it for very long, especially in young adults. In short-term basis and on SOS basis, they're not habit forming.
Okay. Um, uh, is there any technology or a recent development like CBT been used in uh, treatment of anxiety? So, is there any key role being played by CBT for the treatment of anxiety?
Yes, yes, CBT does play a very important role in treatment of anxiety. Because, like I mentioned, that the medications we might give for a few months and then taper and stop those medicines. Okay, but we have to work on improving our coping strategies, reframing our thoughts, certain behavioral techniques which we need to work on, so that if anxiety crops up later in life, we are more prepared to handle it and we learn certain skills. Yeah. So one
Okay.
of the this is where the role of the psychologist comes up, and their main role is, so CBT is one of the techniques which we use for the therapy part. Other techniques are exposure and response prevention. Okay. So when we talk about CBT, can we eliminate anxiety altogether? No, we cannot. We need to fine tune it. So if we have an alarm in our home, if a if an intruder comes at our home and there's an alarm which is buzzing whenever there is something problematic, so can should we need to fine tune that alarm, not stop that alarm altogether. Okay? So
Yeah.
CBT helps us to restructure our thoughts. Basically, it is two parts: cognitive and behavioral therapy. We have to view the situation as in a is not as problematic as our mind is thinking of it to be problematic. Okay, so
Okay.
it teaches us to challenge our thoughts and put our energy into things which we can control. So basically, anxiety happens when we worry about things which we can't control, about future and what will happen, and that makes us feel helpless. And then we feel helpless, then we don't work, then that affects the outcome, and then we again feel sad about it, and that vicious cycle continues. So basically, CBT, like it, challenges us to reframe our thoughts. So it asks us that whether the situation is as problematic or we are thinking it to be problematic, and we focus our thoughts on the situation, on the things which we can control. We can't control the result, but we can increase the possibility of a good result. So if we are worried about the result going bad, there is also some chance of result improving. Okay? So what should I do to increase the possibility of the good result? So that is what the reframing of thought, like that is one of the examples I'm given. Then the other part of it is the behavioral techniques. So what are the things which we need to do, to be able to handle the situation better? And that might include our activity scheduling, which we might have to do during the day. Certain meditation technique, deep breathing exercises, progressive muscle relaxation. These are some of the techniques which help us to cope with the situation in a better manner.
Okay. Uh, do you think that changes in the lifestyle can actually help us to elevate the anxiety? Can you give some examples related to this?
Yeah, so in like I mentioned in CBT, what they do is they work on those thoughts and worries and certain behavioral changes. Okay? And in the behavioral changes, the daily activity scheduling. So what we tell our patients is to do something productive, you know, throughout the day. So if you are, for example, worried about the exam which is coming up, okay? So put your focus on uh, like increase on putting some time to study so that the chances of a better result increase. Okay, so that would be something productive which we are doing. Some form of physical activity. So how physical activity does is when we were talking about the medicines increasing certain neurotransmitters. So when we walk, when we do exercises, that also releases those neurotransmitters, okay, which help us to feel happy and relaxed. And that in the long term helps in rewiring our brain. Okay, so that when we exercise, we might find we feel high or good for a bit. But when we exercise for long term, okay, as a routine, so that helps in building those happy chemicals in our brain, maintaining their level from the core. Okay, and the third aspect is something pleasurable. Okay, so if I'm asking you to take out time for managing your worries, doing problem solving for all the things which are bothering you, okay, also take out time to do activities which you actively love or you enjoy. Okay, so that would not take away from the effort you're putting for your exam, but it would help you re-energize and put your energy in the right direction when it is needed. You
Okay.
know, don't need to worry all the time, but you need to worry well. That is what I tell my patients. You worry about things you can control, okay, and worry to your advantage. We can't tell patients to be positive all the time, but increase the possibility of good outcome to be realistic
Okay.
and put their energy so that you don't feel helpless, you feel more empowered in the situation.
Right.
So that is
Uh,
what I tell the patient. Like if there is a friend of yours who is always telling you, you can't do this, you can't do that, you shouldn't go here, that will be very bad for you, you won't be able to do that. Would you want that person in your life? Okay? Or if that person is around and you can't eliminate it, so you treat it like a background noise. Okay? You keep doing whatever you can so that you gradually learn to be less affected by them.
right.
So if you're scared of public speaking, you might make a few mistakes in the first time, but you'll learn how to do it better.
Yeah.
And then only your growth will happen.
True.
And
Thank you,
another
doctor.
important aspect I forgot to mention is sleep. So sleep hygiene is something which is important for overall lifestyle changes, because that is when we are sleeping, that is when our memories are forming, we are learning new things, and we learn to be relaxed. So that is one aspect also which needs to be worked
Yeah. True. Thank you for sharing those details and addressing the important questions. Thank you for sharing your valuable insights about anxiety disorder and their management. We hope this conversation has been enlightening for our audience. I wish we could continue this conversation, uh, Doctor, but due to time constraints, we'll have to conclude now. But yes, we appreciate your contribution and your valuable insights. Thank you, Doctor, for your valuable time. Thank you.
on.
So, as we wrap up this insightful live event, we have garnered essential understanding about anxiety disorders, their causes, and varied types. Insights into treatments like CBT and medication offered practical solutions for managing anxiety. I thank you all for joining us today for this insightful discussion. If you found this discussion valuable, don't forget to tune in next week for an inspiring patient's journey with migraines, emphasizing strength and unity. Have a great day and take care. Thank you.